Hi, my name is Abigail Simmons, and for my final project, I will be discussing the important material I have learned in the professional communications class, and I will be tying it to my career in nursing and my work in the healthcare field. First off, I would like to talk about nursing, which is the career I am pursuing with my education at Husson University. Nursing is a profession that relies heavily on communication, whether it is with the patient, a patient's family, or other healthcare professionals. Every interaction involves communication. There are certain roles that a nurse has, and they all include different forms of communication. Being a caregiver involves talking to the patient and other healthcare professionals to determine the best plan of care for the patient. One of the roles of the nurse, according to Taylor's Fundamentals of Nursing, is being a communicator. The nurse is said to be the ringleader of the healthcare system, and they have the most interactions with the patient. This leads to a better bond between the nurse and the patient, which leads to a more open communication. The nurse also uses communication to fulfill the roles of the educator and the counselor based on their relationship that they build with the patient. The nurse also communicates as a leader, researcher, and an advocate for the patient, as well as a collaborator. All these roles are based on the patient because nursing evolves around the patient, and it should always be patient-centered care. The patient should be as involved as they can be with their care and decisions, and it all ties back to communication. At Husson, I am part of a professional communications class that has taught me some very important ideas about communicating. It has provided me with new information while also solidifying some older values and communication skills I already have. Before this class, I had not made a resume for myself and have gotten previous jobs through people that I know. A resume is a very important part of applying for a job, and it can give an employer a better idea of the person they could potentially hire. So that is why I feel that the resume was a very valuable part of this class. Another idea that really caught my attention in this class is focusing on who a person is communicating with. Who you are communicating with determines a lot about the conversation, and you can communicate differently with some people than you will others. Focusing on who you are communicating with makes for the most effective and beneficial communication. Being direct and respectful is another idea that has been discussed in this class, though it is not a new idea for me. Being respectful is something that has been taught to me all my life, but it is sometimes difficult to get a point across and be respectful at the same time. This is a difficult concept, but this class helped me to solidify my professionalism when it comes to being direct and respectful. Now that I've talked a little about nursing and the professional communications class, it is time to tie everything together. First off, having a good resume will help me get jobs in the future. My goal is to be a travel nurse, so having a good resume, as well as being a good nurse, could help me get into job locations that I really want to. Now, the who, when it comes to communicating, is very important in the healthcare system. As a nurse, I would communicate differently with patients and patients' families than I would with other healthcare providers. The terminology would be different and the tone would be different in certain situations. For example, another healthcare provider and I could talk about a patient's deadly disease in a pretty professional manner, but when I spoke to the patient about this, I would use a more empathetic tone and describe the issue in simpler terms. When communicating with a patient, I would also have a more casual and personal conversation with them than I may have with a doctor, even though the same topic is addressed. Finally, being direct and respectful leads to better communication and a sense of trust between the patient and the nurse, or the nurse and her colleagues. Being respectful should be a no-brainer when communicating professionally, but it can be difficult to do so in certain situations. Being direct and respectful could and should go hand in hand when communicating professionally. When discussing things with a difficult patient, or even just trying to get a patient to quit a difficult habit, the nurse should be direct, but also respectful as to not upset the patient in an unnecessary way. It is a simple idea that can get overlooked sometimes. I believe this class has led me to improve my communication skills, especially when it comes to focusing on who I am communicating with. It has led me to think about some stuff a little differently, and I will use some of the aspects of this class to make myself a better nurse. I intend to improve my communication further by finishing school. By doing this, I will gain more experiences in communicating, and I will also learn what to do and what not to do by trial and error through my clinical experiences in nursing school and eventually as a nurse. So to finish with a quote, lack of communication leads to a lack of trust that leaves room for doubt. This is very important in the nursing aspect. So if you have any questions or any comments, please let me know. Thank you.